Meghalaya, it's a name that makes you think of mountains and those incredible living root bridges. It's a landscape that's really unlike any other.
It is.
But beyond that beauty, there's this whole other story happening about healthcare and how hard it is to get good quality care to people in a region where the land itself almost seems to be working against it.
Right.
And we are going to take a deep dive into that story today. And I know you're especially interested, I think, in how healthcare actually reaches some of those really far out remote corners of Meghalaya.
It is a fascinating story, really complex.
Yeah.
And you almost have to start by understanding India's public healthcare system.
Okay.
It's this 3-tiered system that's meant to, make healthcare more accessible to everyone.
Right.
But in a state like Meghalaya, with its unique geography, it faces some really specific hurdles.
Okay, so break that down for me a little bit. We've got this system with tertiary care hospitals at the top.
Right.
Then you have district hospitals, community health centers, and then finally those primary health centers and sub-centers kind of fanning out to reach the most remote areas.
Exactly.
And that sounds, at least in theory, pretty comprehensive, right?
On paper, yes. It seems that way.
Yeah.
But the reality on the ground, well, it's a lot more complicated, I guess. You have Nigri HMS in Shillong, the Northeastern Indira Gandhi Regional Institute of Health and Medical Sciences. That's the full name.
Okay.
It's a really advanced medical care facility equipped to handle some really complex cases.
Okay.
But then, you travel a few hours outside of Shillong, outside the capital, and what you find is that district hospitals and community health centers, they're lacking even basic specialists.
Wow.
And the equipment they need.
So it's almost like, I don't know, like having this super high-speed internet connection, but only one device that can actually connect to it.
Right.
All that potential, but it's not getting to everyone.
Yeah.
And affordability, I feel like, has got to be a huge factor, too.
It is.
Especially in a state where a pretty big chunk of the population lives in these rural areas.
Absolutely. That's where schemes like MHIS, the Meghalaya Health Insurance Scheme, and Ayushman Bharat, these national programs, they really come in. These programs aim to make healthcare affordable, even for the lowest income brackets. MHIS is specifically for Meghalaya residents, whereas Ayushman Bharat, that's a national scheme.
But, from some of the stuff I've read, reaching those rural populations and making sure they actually know these programs exist is a huge problem.
It is.
Right?
Absolutely.
It's not enough to have the schemes. You really need to get it to the people.
You got to close that gap. Awareness is a big issue. Many people, they just don't know about these schemes.
Right.
And even if they do know, sometimes they don't understand how to use them.
Yeah.
And then there's the trust element.
Right.
Certain communities, they might be hesitant to engage with these programs just because of bad experiences in the past or even cultural beliefs.
Sure. Which I would imagine makes this even more critical when you're talking about maternal and infant health, which from our sources, that seems to be a huge concern in Meghalaya.
It's a huge problem.
Yeah.
Despite the government's efforts, things like the Janani Suraksha Yojana or JSY and the Pradhan Mantru Vandana Yojana, which is PMMVY, these programs that try to incentivize institutional deliveries, Meghalaya still has really high maternal and infant mortality rates.
So these programs, they're basically encouraging expecting mothers to give birth in hospitals where they can get that medical care.
Right.
But are you saying they're not always choosing that?
They're not. And, there are a lot of factors at play.
Yeah.
In a lot of tribal communities, home births are the norm.
Yeah.
It's a cultural belief. And then practically speaking, reaching a hospital on time.
Yeah.
It can be really difficult, especially for those in remote areas with limited transportation.
It's almost like a disconnect between, this good intention of the programs.
There is.
And the reality for people in these remote areas.
Yeah.
But, and I read this, the government's trying to address this with these mobile medical units.
They are.
Yes.
Mobile medical units, or MMUs.
Okay.
It's a pretty creative approach, really. It's basically a clinic on wheels.
Okay.
Bringing healthcare to the remote villages.
Yeah.
They can handle basic diagnoses, treatments, even some minor procedures.
Wow.
And they play a vital role in reaching these communities that wouldn't have access otherwise.
So it sounds like, it's a step in the right direction, a good step.
It is.
But even with those MMUs, I imagine there are still challenges.
There are.
Right. I mean, just covering a state like Meghalaya, geographically diverse as it is, can't be easy.
Of course, they face their own hurdles.
Yeah.
Staffing is a big one. Finding qualified people who are willing to work on these units,
right,
often in remote, challenging conditions.
Yeah.
It's a real struggle. And then you have the logistics of it.
Yeah.
Keeping the units stocked with supplies, meds, making sure that they're maintained.
Right.
Dealing with breakdowns.
Right.
All that.
It was like a constant balancing act to get those resources where they need to be.
It is.
And then on top of all that, you've got this other problem.
Yeah.
As this is something our sources highlight a lot, is this malnutrition coupled with a pretty heavy disease burden in Meghalaya. And it feels like one just makes the other one worse,
Exactly. Malnutrition weakens the immune system.
Right.
And that makes people more vulnerable to malaria, dengue, tuberculosis, and it just keeps cycling because the illness can lead to more malnutrition.
So are you saying it's not just about treating the immediate illness? It's about addressing what leads to it.
You got to fix the root of the problem.
Like those underlying issues that cause the poor health in the first place.
Exactly. You need a more holistic approach.
Yeah.
One that looks at clean water, sanitation, nutritious food, all alongside medical care.
It's almost like, have you ever seen one of those ropes that are all knotted up? It's like that. You can't just pull one end.
Right.
You have to really work through each knot to find the solution. And speaking of solutions, I know the government's looking into digital health and telemedicine.
They are?
To help fix some of this. Are you seeing any progress with that at all?
There's definitely potential there.
Okay.
Especially for a state like Meghalaya. Imagine, you've got a specialist in Shillong.
Yeah.
And they can diagnose and treat a patient in a remote village.
Yeah.
Just through video conferencing.
Yeah.
I mean, that would be huge.
Yeah.
But internet connectivity, it's still a major obstacle. A lot of those villages, they have very limited internet access.
Right.
Or not at all.
So we're kind of back at that same problem of accessibility again.
We are.
Which I guess reminds us that even the most innovative ideas are only as good as their ability to reach the people that need them. And, when 80% of the state is hilly terrain, as it is in Meghalaya, just basic infrastructure becomes a huge, huge problem.
It does. You're absolutely right. It's not just about hospitals. You've got to make sure ambulances can reach patients, supplies can be transported.
Yeah.
Healthcare workers can access these areas. It's a logistical nightmare.
It sounds like it. And I remember reading this thing, I can't remember where, about ambulances struggling to get to people in villages because the roads are so bad.
Yeah.
I mean, that's a pretty powerful image, isn't it?
It is.
That just brings it home, this is the reality.
It shows how important it is to think about every aspect of the healthcare system. It can't just be hospitals and doctors. You need the support, the transportation, the communication, the community engagement.
It's like you're connecting the dots. You've got to create this system that's really designed for the people it serves. Now, we've talked a lot about these physical barriers.
Right.
But I'm curious about the human element. It seems like finding and keeping qualified medical people
It's a challenge.
in rural Meghalaya
Big time.
is another big piece of this puzzle.
It is. There's a natural concentration of doctors and specialists in Shillong.
Of course. That's where the best facilities are.
Exactly.
I mean, if you're a doctor and you spend all this time training, specializing, you want to be in a place where you can actually use your skills.
Yeah.
That usually means a good hospital,
It is.
the latest technology, the resources.
Exactly.
And while there might be some financial incentives to get people to work in rural areas,
They're often not enough.
Yeah.
No. They just don't outweigh the challenge.
Right. And those challenges could be things like decent housing, education for their kids, feeling isolated professionally.
Exactly that.
So it's a lot to ask, isn't it?
It is.
You're asking someone to leave their life,
Yeah.
maybe compromise their career, to serve in a place that just doesn't have a lot.
Exactly.
And because there aren't enough specialists in these rural areas, people often have to travel to Shillong
They do.
or even further for treatment.
It's a common situation, unfortunately.
Right.
And it puts a strain on the patients and the healthcare system in Shillong.
Yeah.
Can you imagine traveling for hours, days even, just to see a specialist?
Absolutely.
For something that could have been taken care of locally.
Yeah.
If they had the resources.
Yeah.
We need to improve healthcare
Yeah.
in those districts.
Yeah.
Make those areas more self-sufficient.
So it's not just about that basic care, right? It's about making sure those areas can handle the tougher cases.
Exactly. Yeah. And, as Meghalaya develops, we're seeing more than just things like malaria or tuberculosis.
Right.
Lifestyle diseases are on the rise.
Yeah.
Diabetes, hypertension.
Okay.
Heart disease.
Right.
That adds another layer of complexity.
Yeah.
It requires specialized care.
Right.
And long-term management.
Right. It's like the needs of the state are changing,
They are.
But the infrastructure's not keeping up.
Exactly.
And it doesn't sound like the private sector has really stepped in to help much outside of Shillong.
It's limited. It's just not there.
Is it? Why is that?
Well, it's the economics of it, right?
Okay.
The cost of operating is high.
Yeah.
The profit potential is lower.
Right.
And there are concerns about whether people can afford private care.
Right.
It's a risky investment.
Yeah.
And unless there are good incentives,
a
lot of private companies, they just won't see it as worthwhile.
So that leaves us with a big question then.
Yeah.
How do we make healthcare in Meghalaya more accessible? More effective? And how do we make sure it's fair for everyone?
It's the big question.
Especially with all these challenges.
It is daunting.
It sounds like it.
But I wouldn't say impossible.
No.
And that's what we're going to talk about next.
Okay.
We'll look at how the private sector, public-private partnerships, and maybe even some new ways of thinking could be the key to a healthier future for Meghalaya.
So we've spent part one really laying out those healthcare challenges in Meghalaya. Everything from the terrain to the availability of specialists and even people just knowing what programs can help them with the cost of care.
Right.
It really feels like a puzzle with a ton of pieces.
It does.
But I'm curious, where does private healthcare fit into all this? Especially in those areas where the government's resources are just stretched so thin.
That's a great question.
Yeah.
It's a key piece of this puzzle. We tend to focus so much on the public sector, but the private sector can do a lot to expand access to care, especially in Meghalaya.
Okay, so we talked about the government's efforts, the challenges they face.
Right.
But you said earlier that outside of Shillong, there's not a lot of private sector involvement.
Not really, no.
Why is that? Is it just about the money?
It's a little more complicated than that.
Okay.
I mean, setting up a hospital, even a clinic in rural Meghalaya, it's expensive.
Right.
You've got infrastructure costs, equipment, staff, and then keeping it running. That costs money, too.
Right. And from what we read, even if there is profit potential, there's that worry about people being able to afford it.
That's right.
Right. So it's kind of a catch-22. Private healthcare could offer more options, but can people actually use those options?
That is the issue.
Yeah.
Private care can fill those gaps. But it has to be something both the provider and the patient can actually manage financially.
So you're thinking maybe some specific government policies or incentives could make a difference.
Yeah.
Okay, like what? Can you give some examples?
Sure.
Yeah.
Think about tax breaks or subsidies for those private hospitals that are willing to set up in rural areas.
Okay.
Or maybe the government guarantees a certain number of patients through the health insurance schemes.
Right.
That creates a more predictable income.
So it's like giving those private investors a little bit of a safety net to reduce the risk and make it more attractive.
Exactly.
Something else we read about was these public-private partnerships.
Yeah, PPPs.
Can you tell us a bit more about that?
PPPs are really interesting.
Okay.
Imagine this.
Yeah.
Instead of building a new government hospital, which is incredibly expensive, they partner with a private company to create a specialized diagnostic center within the existing district hospital.
So you're using the existing infrastructure and combining the government's local knowledge with the private sector's efficiency.
Exactly.
I like that idea.
Yeah.
But what about the affordability for patients?
Right. That's where you have to be really careful in the planning.
Okay.
The PPP could have a system where the government helps pay for some of the essential tests to make them affordable while still making sure the private company is paid fairly.
So it's not just about spending a bunch of money.
No.
It's about being strategic and making a sustainable system that helps everyone.
Absolutely.
But even with all that, we can't ignore the fact that internet access is still unreliable in many parts of Meghalaya.
Yeah, that's true.
And that limits what we can do with things like telemedicine.
You're right.
Right.
Technology can make a big difference, but only if people can actually use it.
Right.
We need to do a few things at once.
Okay.
Like expanding the physical stuff.
Right.
roads, and communication networks, but also investing in digital health solutions.
So while we're working on getting those fiber optic cables to those villages, we can focus on setting up those diagnostic centers.
Exactly.
Creating a network of healthcare hubs.
Yep.
And then once the internet catches up, we can really use telemedicine, connect those rural communities with specialists in Shillong or even further.
It's about phases.
Yeah.
Taking care of immediate needs and looking towards the future.
Right.
It's not either.
Yeah.
It's about making it all work together.
It does feel like we're moving past just talking about the problems to thinking about real solutions. So I have to ask, are there any other creative ideas you've come across for improving healthcare access in Meghalaya?
One that's really interesting is using corporate social responsibility.
Okay, CSR. Yeah.
We talked about how private hospitals have these financial concerns.
Right.
What if big companies, with their CSR programs, adopted or supported government hospitals?
Okay, so instead of just giving money, they could provide training, donate equipment, help with upgrades.
Exactly.
I like that.
Yeah, it could benefit everyone.
Yeah, it would.
The companies do something good.
Yeah.
And the communities get better health care.
Right, so finding those win-win situations.
Exactly.
And we can't forget about the role of technology.
Right.
We've talked about telemedicine, but what about AI?
It could be huge.
For diagnostics, right.
Yeah.
Imagine a device that can do blood tests and analyze the results quickly and accurately,
right,
even in really remote areas.
It's amazing.
It's like we're on the edge of a healthcare revolution where technology can help us solve these issues of distance and resources, but it's not just about picking one solution.
Right.
We need to find the right mix for Meghalaya.
Exactly.
What do you think are the most important elements of that mix?
Well, from everything we've talked about, I think we can agree that we have to improve healthcare in those districts, make them less reliant on Shillong for specialized care.
Right. And that goes hand in hand with getting qualified people to work in those rural areas.
Absolutely.
We can't just build stuff. We need the doctors and nurses to staff them.
That's right.
And provide quality care.
Exactly.
Which means thinking about the things we mentioned earlier, like housing, education, making sure those professionals don't feel isolated. And it's not just the doctors and nurses.
No, it's not.
We need to strengthen the whole system.
Yeah.
Ambulances, emergency response, even community health workers.
It all matters.
It does.
And as we move forward, integrating telemedicine and AI, once that internet access improves, that's going to be huge for reaching everyone and making healthcare accessible.
It does feel like we're putting together a plan for the future of healthcare in Meghalaya.
It does.
But I think it's important to remember that putting these solutions into practice, it won't be easy.
It won't.
What are some of the things that might get in the way?
That's a good question.
Yeah.
One of the biggest challenges, I think, is going to be all the red tape.
Right, the bureaucracy.
Yeah.
Yeah.
Even with the best plans, things can move slowly.
Yeah.
Especially in a place like Meghalaya.
Right. And navigating that political and administrative stuff.
It's tough.
It can feel impossible, like untangling a really bad knot.
It can.
What else stands out to you?
Well, funding is always a concern.
Right.
Most of these things we've talked about, building infrastructure, attracting people to work there, technology, they all cost money.
Right. And it's not just about getting the money. Well, it's about spending it wisely and making sure things are transparent.
Exactly.
That's something our sources really focused on.
Yeah.
The importance of good governance to make real improvements to healthcare.
Absolutely.
And we can't forget about the people.
Right. Community engagement. It's crucial. We can't just create programs and force them on people.
Right.
We have to work with communities, understand their needs, their concerns.
Yeah.
Make sure the solutions actually fit their lives.
Right. Build trust. Make sure this system is listening to the people it's meant to serve.
Exactly.
And that takes time.
It does. And a willingness to adapt. This has been a really insightful conversation.
It has.
And we've covered a lot. But as we wrap up this part, is there any one thing you think our listeners should really remember?
I think the most important thing is this. There's no easy fix.
Yeah.
There's no one solution.
Right.
It's about understanding that this is complicated.
Yeah.
Thinking about different solutions and then finding the right combination for Meghalaya.
Yeah.
For its unique challenges and opportunities.
That's a great point.
Yeah.
So it's about embracing that complexity and realizing that this journey to better healthcare is going to take a lot of collaboration and innovation.
Absolutely. And a commitment to making sure everyone is included.
Exactly.
We started by picturing that amazing landscape in Meghalaya.
We did.
And then we dove into the reality of its healthcare system.
Yeah, quite a journey.
It has been. But it feels like we did more than just point out the problems.
Yeah.
We actually started thinking about solutions.
We did.
From PPPs to technology, even CSR initiatives.
It's exciting. It's so much potential.
And what's really cool is that there's no one answer.
Right.
It's not about finding that magic bullet.
It's about recognizing that each problem needs a specific approach.
Yeah.
A mix of strategies that work together.
Right, to build that stronger system. And that system, like you said, it's way more than just hospitals and doctors.
It is.
It's about those support networks, too. The ambulance services, emergency response, community health workers, even just getting people to where they need to go.
Exactly.
It's about making sure everything works together.
It is.
To create a system that really helps people.
And that's where the potential is. Not in those big sweeping changes,
right,
but in those smaller, more focused solutions that actually work for each community.
And those communities, their needs are changing, too. We talked about it. It's not just infectious diseases anymore.
No, it's not.
There's diabetes, heart disease.
Right, those lifestyle diseases.
Yeah, and those require a different way of thinking.
They do.
It's not just about treating someone. It's about giving them the tools to manage their own health.
Exactly.
And that's where community engagement comes back in.
It's crucial.
Right, building that trust, open communication,
Mm-hmm.
and making sure that the people who are affected by the solutions are actually involved in creating them.
Absolutely.
It's about collaboration.
It is.
And that's what gives me hope for Meghalaya.
Me too.
There's this feeling that everyone wants to work together to create a healthier future.
It's inspiring.
It is. It feels like we've come full circle.
We have.
From those beautiful landscapes to the hard reality of the healthcare system. And even though the challenges are real,
They are.
there's also hope.
Definitely.
A belief that we can make things better with innovation, collaboration, and commitment.
Absolutely.
I think that's a good place to end.
It is.
We've looked at the problems, the possible solutions, and the resilience of the people in Meghalaya. It's a good reminder that even when things are tough, there's always hope that we can create a better future.
Thank you for joining us on this deep dive